Yo, yo, yo. Hey, guys, welcome back to another awesome edition of the Best Practices Show podcast. You ever thought to yourself, I got to grow my practice. I got to find a better way to connect with these patients and have a little bit more fun at work. Well, if you've ever thought that, today I'm going to bring on a man who wrote a great book called Treating People, Not Patients. A great friend of mine from way back, Dr. Michael Sonick. You have to read his book. And today we talk about what's in the book and how it can be a huge advantage to helping you connect better with the patients you see every day. So please listen to this episode. I hope you enjoy it. We'll see you guys soon. Hey guys, welcome back to the Best Practices Show podcast. You know the jam here. I get to hang out with the coolest people in dentistry. Some of them are my friends, and they get to share great wisdom so that you guys can create a better practice and a better life. And I have an old friend of mine that we're bringing on today, Dr. Michael Sonick, and we've known each other for quite a long time. It's the first time I've had him on the podcast. And so I had to stalk him because he's a busy guy and get him on the podcast. And he's written a new book. It's a great new book, Treating People, Not Patients. And we're going to learn about how to create a successful practice and really transformational insights on how you can better connect with human beings. Mike, thanks for being on, brother. Appreciate you.
My pleasure. Thank you for having me.
Yeah, you and I have known each other for a long time. A long time. So, but today we're going to be talking about a lot of stuff, and you're in a really unique place right now with your educational, platform and what you're doing. I want people to know, because we have a lot of young listeners. I've got a lot of dental students. Who's Dr. Michael Sonick? What do you do? Let's start there first.
Sure. I'm a periodontist, and I've been a periodontist. I graduated from dental school a long time ago, 1979. So I've been doing dentistry for over 40 years. And then I did my periodontal residency down at Emory University, and went to practice. I worked with Dennis Tarnow as an educator in 1984 at NYU, and I've been at NYU since 1984 teaching in continuing education department there. A large part of my practice has been in education, which is interesting because when I talk to patients, it's also about education. So, but I'm known as a clinician because I worked real hard at becoming a good surgeon. I've written many articles. I have a textbook on bone regeneration, on implant site development that's used in residency programs for bone grafting. I've written 4 or 5 books, on various forms of surgery. And people say, hey, you're a good surgeon. Let me learn about that. And I do teach that, and I've been teaching that for 40 years. But my true passion, and has always been my passion, is treating people, and hence the title of the book, Treating People, Not Patients. So I'm a clinician. But most dentists, we're not taught how to treat people in dental school. What are we taught? We're taught how to do crown lengthening, extractions, orthodontics, veneers, bonding. We even have requirements. You have to do 30 of this restoration. I had to make 4 dentures. I had to do 6 periodontal surgeries. I didn't have to be nice to anybody. I wasn't taught how to be nice to any of the people in my practice. They didn't teach us integrity. They didn't teach us transformational, powers over patients. They didn't teach us neuro-linguistic programming. They didn't teach us the most important thing that we can do for a patient, and that's to make them feel safe and comfortable in our environment. We were talking about Todd Williams earlier, the lecturer, and what he does, he works at the Four Seasons. Now, if you stay at a Four Seasons hotel, you have nice sheets at home. You have good food at home. Let's say you spend, $15,000 a night for the great suite at a hotel. For $15,000, I don't need a bed. I can get a bed for like a couple $100. I have a bed at home. Matter of fact, I have 4 beds at my home. I can sleep at any of them. But why do I spend $15,000 at a Four Seasons? And when Todd in his lecture, he talks about it, he says the people that spend that kind of money have better sheets at home. They get better food at home. They have a better TV at home. They have a better sound system at home. They probably live in a nicer neighborhood. So why are they there? He says they're there because they want the Four Seasons clientele to take away the absence of worry. They don't want to be worried about anything. They just want to relax. And when a patient comes into a dental office, it's not the Four Seasons Hotel. They come into our office, and we're not giving them a great experience. We're giving them anesthetic. We're jabbing them. We have more knowledge than they do. We make them feel inferior. They already feel terrible because their mouth's in bad shape. They feel guilty. They come in with so much baggage and preconceived notions of what's going to happen to them when they're in our office. So the first thing that I need to know about that patient is, what are they worried about? And let me take that away immediately. And I try to find that out. And we can talk about what those things are and how we go about doing it.
Yeah,
so.
I absolutely do. Now, this is really important because you're speaking my jam. Dentists aren't taught a lot of these things. And you're a busy guy. Why were you motivated to write this book?
I didn't grow up rich, as most dentists that are my age are. Most of us, grew up in blue collar families, and we wanted to better ourselves. Today, as we talked about earlier, a lot of dentists come from, their parents are dentists, so they grew up pretty comfortable because it's so expensive to get through dental school. So it's a little bit different, the students today, than it were when I was there. Well, we were sort of idealistic, and most of us worked hard. So as a kid, I had to work, and I worked for my dad. He had a furniture store. I did a lot of manual work on that. But I also, for whatever reason, I was a lifeguard, and I liked taking care of the people on the beach, when they had wounds and got cut and things. But then somehow I got attracted to the restaurant industry, and I started waiting on tables. And I stopped lifeguarding in the summer. I said, I'm going to go to Kennebunkport. So I went up to Kennebunkport, Maine, right down the street from where George Bush's was, and I was at the Shawmut Inn, and I started waiting on tables. And one of these guys, his name was Bart, that I worked with, he had like a handlebar mustache. Now, God, I was 20 years old. This guy was like 22 with a handlebar mustache. He wore a vest. He had a little corkscrew, in his belt so he could open up wine. For me, a good wine back there was Matus or Boone's Farm. It was a turn. I didn't even know how to open up a cork. So I started watching this guy give hospitality, and he was into it. And so I started to mirror him, and I started to do some of the things. And then I went on to bartend. I played cocktail piano. I worked in the kitchen, and I just loved hospitality. I just loved working in the restaurant business. Now, I'm a bit of a foodie, whatever that means. I mean, most of us are today. We all like good food. Whenever I go into a restaurant, I check it out. And for me, the restaurant became the model for running a good dental practice, except the restaurant's a little different. They don't serve dentistry. They serve food. But the three things that Zaggett's, you remember Zaggett's? There's a guy.
Yeah, absolutely.
They were bought, I think, by Google. They're not much around anymore. But it was two people called Nina and Tim Zaggett. They were at Yale University as students, and they loved to eat. And so as they started to go out and motivate other people to eat at their restaurants, they would send out little tickets, and they go, "Hey, what do you think of this restaurant?" And he goes, "If you give us a review, we'll put you in this little book." And then they started selling the books. So basically, they took what people were doing, writing up restaurant reviews, putting them in a book, and then selling the books. And what they did is they distilled the way they reviewed a restaurant down to three things: the food, the service, and the decor. And I opened up my practice. I got out of school in 79. I did a residency, and I bounced around. I worked in other offices, but I opened up my practice pretty much in January of 1985. It's the same year that Danny Meyer opened up his restaurant in New York, which was Union Square Cafe. The same year Centro Restaurant opened up, which is next door to me, it's still open. In the same year that Pasta Nostra opened up by Joe Bruno, which just closed last week in Norwalk. Those are my three favorite restaurants. Mm-hmm. And they happen to be open up at the same time, which is just a coincidence. So I started to look at these successful restaurants and what they did. And I noticed that when I walked into those restaurants, I felt good. Now, the food was good, and the decor was really nice, but the service was really special. They made me feel really good. And the worst thing to do is to feel bad when you're paying somebody, for food. Because I can cook. Most people can cook. We can go at home. We can get prepared foods. But when you're in a restaurant, you want it to look nice. And so I started to look at successful businesses, not just restaurants, any business, your business, for example. When I email you, guess what? You email me back. That doesn't happen in most businesses. Matter of fact, only about 2% of the businesses are responsive like you are. And it's reflective in your success because you're there helping people. So what I'm talking about, you could have written this book because this book is all about connecting with other humans. And you've been to my study club twice. And not many people get invited back, especially on a, quote, soft subject about being nice to people. This is the subject of my book. But you came into the group of my dentists. We had about 30, 35 dentists, but there was no team there. I'm thinking these dentists are not going to bring back what Kirk talked to them to their offices. They're just going to sit there and they're going to go, oh, that was really good. We should do this. And that's it. So I had your back. And I had 400 people there to listen to you with their entire teams. Now, that is more impactful because it's all really about the team. So how did I get involved in this? It just happened organically. I didn't open up my practice thinking that I'm going to do this. You know, my mom was a decorator. My dad was in the furniture business. My dad was also an engineer. So I had an analytical mind. But I just always liked things to be organized. And I think there are certain things that are, God-given, and there are certain things that we learn. So my God-given talent is probably organization, and common sense. I just like to organize things. I wasn't given great hands. Now, I'm known as a dentist that does good surgery, but I wasn't that guy that just picked up a block of wax and could carve a tooth in 15 minutes. I had to work really hard to get good hands, I was the overachiever. I was pretty much an overachiever as a surgeon. But the human connection piece, I don't know. I had that early on. I always used to look around. I was quiet as a kid. I was president of my school, but I wasn't at the cool table. I was at every table. I love to watch people and see how they work. And, I'd like to get to know them and figure them out. That's probably my secret skill, is I sort of know what you're thinking before you even know you're thinking it, because I pay attention. But I practice that. It's not something that's natural over and over again. So with patients, if I'm talking too much, just let me know. I'll just stop.
No, that's great.
Okay, with patients, when patients come in to see me, I got to read them quickly, right? How much time do we have? It's a blink, Malcolm Gladwell talks about that. He wrote a book called Blink. You see someone, immediately if you like them. Now you say I have a good memory. We were talking. You say you have a good memory for you. Well, why do I have a good memory for you? Because you made an impact upon me. You made that first impression. I know exactly what you said to me the first thing. You go, how are you doing? And I turned to you and I said, because you're from the Midwest and I'm from the Northeast, I go, what do you mean, how you doing? I go, I want to know how you're doing. I go, are you really serious? Want to know how I'm doing? I don't know if you remember that. And then I realized after getting to know you, that's just who you are. You have an interest in people. And it doesn't really matter who they are, and that's important. You can't treat someone well just because you think they're worthy of being treated well. That's one of the things that. Have you ever been to a meeting, Kirk, and you're there and you're talking to someone, they don't know who you are, and you're talking to someone, and then all of a sudden they see somebody more important than you, They see George Bush behind you, okay? I don't want to get political, or Arnold Schwarzenegger. They see him, they go, let me talk to Arnold. But the greats don't do that. Now, Dennis Tarnow is a good friend of mine, and then most of your viewers probably know who he is, and he was my mentor. And I remember talking to Dennis at a meeting, and this was early on in my career. And we're talking one-on-one. And I was not well-known at the time, but well-known people would walk by and try to interrupt the conversation. Dennis never veered. He didn't talk to anybody that was more important than me. I was just, out of school a few years, but he still spent the time talking to me. And I always remember that about him. I never said that to him, but I think I will. I'll mention that to him. I have 6 pages about Dennis Tarnow in my book and how he became a great teacher and how he mentored me.
That's incredible. You've had a great. Now, let me ask you a question, because I love this topic, and we're going to talk about the book. But let's say I'm a dentist listening. Yeah. Mike, it's very easy to do the technical education path. Technical's easy. It's sexy. It's exciting. Yeah. And if you're a young, entrepreneur wannabe in this whole process, how important are the soft skills you're talking about? Like, if you could go back in a time machine and give yourself, some advice, what would you say to a 32-year-old younger self?
Yeah, that's a great question. I have made a lot of mistakes in my life, okay, in every areas. But for some reason, early on, I did not have any true mentors in the soft skills. They weren't there. But I always liked them. So what's the question? Why don't I answer your question instead of riffing again? So
well, just, the natural path of any dentist listening is like, Dr. Sonick, I understand what you're saying. This is important. But you know what? There's an implant course coming up. Technical education is an easier path. And I've always been taught, you hear this all the time, just be a great dentist and everything will take care of itself. Well, that isn't always true. You have to learn how to run a business, have the soft skills, and know how to treat people. And, you also see the other side of it. We see some not so great dentists that were amazing human beings, and they threw the keggers in dental school and they created successful practices. Now, I'm not supporting that and saying that's the direction you need to go, but you got to have a healthy balance of soft skills and technical skills, right?
Yeah. So let's go back to the restaurant. I mean, there are plenty of restaurants that are beautiful and they have good service, but if the food isn't very good, you're not going back. So same with a dentist. You have to have a minimal level of skills. Now, most of the skills that we have that are, patients really can't assess them. It's hard to find a good dentist. There's a great physician in my town. Went to Yale, Harvard Medical School. He's brilliant, got a photographic memory. He recommends a terrible dentist. All right? He doesn't know. He doesn't know. And one of my patients said, I go, why are you seeing this? I said to him, why are you seeing this dentist? He's a nice guy, but I give him a C. But this physician is an A plus. It's impossible to replace. But he was referred there by that physician. So it's hard for patients to assess our clinical skills, unless it's a single front tooth, or maybe even orthodontists. If their front 6 teeth are lined, they don't know about the occlusion. How do they assess this? Were they nice? Did it hurt? What was the price? Those are easy ways to assess. But it really doesn't really talk about the clinical skills. So let me get back to your question. If you don't have the soft skills, and what the soft skills are, the ability to relate to other human beings, to get them to trust you, because it's really all about trust. If you don't get people to trust you, they're not going to buy from you. And we're in a sales business, and I don't think that's a dirty word anymore because we are sales. We're professionals. Professionals means, what's the definition of professional? Someone who sells a skill.
Right.
And that they talk about professions. What's the oldest living profession? They talk about that. Someone's selling something, right? And we as dentists, our skills, we have unique skills. Very few people have the skill. We have 350 million people in the country, and we maybe have 160,000 dentists. I don't know if that's right, but something like that. There aren't too many dentists in the country that have gone through the skills. So we have struggled. And everything that we did to become a dentist has nothing to do with soft skills. First of all, you had to get good grades in high school. Then you had to get good board scores. Then you had to join clubs. Then you had to interview well. And then you have to do well in your SATs. And then you had to do well in dental school. But that doesn't really make you a good dentist. The process to become a dentist has nothing to do with being a good dentist, unfortunately. So it's important to have those skills, but you have to know how to relate to other human beings and to make them feel comfortable. And how do you teach that? That is probably the hardest thing that I have to teach. I give a course on suturing and flap design. First of all, very few people know how to suture and lay a flap. But I can show them. I go, this suture is this size. This is dissolvable. This one is not. I can show them all those things, and it becomes clear. Now, the thing about education, which is sort of tricky, is most people don't remember very much about what you taught. And I think the number is probably 5%, but it's probably less than that. But 5% is what people remember. I remember a few things from your course, which is amazing that I remember that from your course, and then you're blown away that I remember it 8 years later. But you made an impact upon me because you were speaking a language that I was attracted to. You were being a human being that I was attracted to. And I hope that as a man this doesn't bother you, but I was attracted to your message, okay? And it was a great message. And that's why I brought you back. And then when you and I talk, we have so many things in common where we're attracted to the same thing. Most dentists aren't attracted to this. Most dentists went into dentistry because they like to work with their hands, because their parents were dentists, because they were good at school, because they were not given a choice of doing anything but being a professional. In my own case, I wanted to be a musician. I wanted to be a piano player and an actor. So my mom says, yeah, you'll be real successful playing in Manhattan Savings Bank on 86th and 3rd Avenue at noon for the retired women with blue hair. So that was what my mom said. And I think about my mom every day because she's right. Because they're great pianists in those hotel rooms and the lobbies. I walk into a great hotel in any city, it's in Vegas, you're in Bellagio, someone's playing a piano, nobody's listening to them, but they're phenomenal. And that's where I would have ended up, nobody listening to me, if I was successful as a piano player. So I became a dentist because I was told I only had two choices, doctor or lawyer. That was it. My father joked, he goes, you can work in the furniture business and repair furniture all day long. So what did I do? I made it my own. I made it my own by creating teaching, education, where I can be in front of people and talking to people. And I created an environment that was pretty cool. I love going to work every day. Yeah. I can't say when a dentist calls me up and say, "Hey, Mike, I got a great case." I don't think about that. It's a great case. We're going to make a lot of money. We're going to take out a lot of teeth. We're going to do a lot of bone graft. That doesn't excite me. What excites me is transforming that patient. So I think what's important for the younger people is writing down a mission statement and figuring out where they want to go with their lives. Do you just want to do crowns all day long and make a lot of money? You can do that. Then maybe you don't want to build your own private practice because you're going to have somebody to help you. And I've worked with many dentists. I've had 4 or 5 partners over the course of my career. And most of the partners I've worked with don't really have that vision. They're great dentists and they're really smart. And I said, you have to, I try to encourage them to have that, but they don't feel it. So can it be taught, which is an important thing? And I do think it can be. You can develop an interest in this because a lot of people feel that this is for somebody else. Once people understand the message that's in my book that I wrote during COVID, but I've been practicing for 35 years, you're going to start to see something in there saying, I can make this a little bit better. No one's going to be me. No one's anybody. I'm the only one's going to be me. You're the only one's going to be you. The people who are listening, you're all unique in your own way. But there are certain skills that you can use to ameliorate the way you're practicing to get more patients to say yes to the treatment that you want to provide.
Yeah.
You know what's the nice thing about this? There's two things that I like. One is it decreases your stress level because it becomes a lot more fun. And I think that's what you teach. You want to have more fun at work because you teach soft and hard skills. You want to have more fun at work because everything becomes systemized and you become a lot more efficient.
Right.
I don't have too many patient complaints, because I handle them immediately and I know what they're going to complain about, so I don't want to go there. So if it's going to be about money, we could talk about how do you manage complaints. That could be another podcast because I love that one. I love dealing with a disgruntled patient. That's one of my favorites. Because everybody always say, "Oh, what a bad patient." They go, "No, you're the problem, not the patient." Okay, because the solution's in you, not the patient.
Yeah. So now go back to this, Mike. Yeah. So I love books. I grew up on books in dentistry, right. And so treating people, not patients. I want people to read your book. And if I was going to read, if I'm a young dentist reading this book, what do you hope I take away from your book?
Well, I hope that you take away from the book the reason why you went to practice in the first place, and that's to help other people. And I think in the book there is a number, it's 10 chapters, and each chapter has about 15 to 20 questions that you can use as a workbook. And what you'll take away from the book is the importance of being there for patient, the importance of making a patient feel safe, the importance of creating a comfortable environment through decor, because people look at everything.
Right.
As simple as fingernails. I mean, do you have a written policy of what the fingernail should look like? I mean, I don't want to talk to one of my female assistants and say, hey, you shouldn't have those long pointy fingernails. But I can say that to them before I hire them. So there's an expectation. So I think it's also very important to create the team, because you have a team. You and I have actually the same size teams. I have 22 people in my office. You have about the same in your practice. So in my office, everybody, I don't get to see every patient. I don't get to have every interaction. I don't know how many interactions there are a day. I'd say there's probably between about 7,000 or 8,000 interactions in my office a day, between phone calls, emails, patients coming and going. Those are 7,000 or 8,000 opportunities for things to go wrong. So that whole team has to have the same philosophy built in. So how do you create that team philosophy? And I specifically show people how to create that in the book. And the importance of mentorship, the educational process. I have many mentors. I spend a lot of money every year taking courses and still going. Not so much on suturing, but on other things that are related to the practice. And how to build that servant-hearted team that gives every patient a wow experience. I want everybody to leave my practice saying, great, that was great. We have over 3,000 five-star reviews online. I mean, I don't ask for the reviews. They just put them up there. Yeah. And, it's nice to see. Not a day goes by in my practice where at least 4 or 5 people say, how did you get such a great team?
Yeah. Now go back to that, because I want to know the answer to that question, as best we can in a podcast. Yeah. You still do the hiring in your practice. So give us some philosophy. First of all, you hear this from dentists all the time. There's no great people out there. Do you ever hear that one? And hiring is hard. You never heard that. You still do the hiring in your practice. How have you done this? Give us some insight.
Well, I have a chapter in the book on how to hire. I also have a video on how to hire. And so it makes it very, very easy. There's a process that we go through. I have 4 pages of written how do we hire. So the first thing is we craft an ad and we put the ad up. And we have Indeed and Merit and other places. And then the ad's fairly generic, but it's very upbeat and written positively. Once someone responds to the ad, we send them what's called a culture index. I'll explain that in a second, and an application for employment. We already have their resume because that's there. So I have the resume, I have their application for employment, which has just basic information, salary, where they live, etc. And then the culture index. And once I get that information back, my team reviews it. I don't see any of it at this time. If the team thinks they're relatively good, they send them to me, and then I review it. So I review perhaps 10 to 20 resumes and culture indices a week. You may think that may take me a long time, but it doesn't. It takes me about 4 or 5 minutes. So 4 or 5 minutes every week, I will review them. If I like them, then I will talk to my senior person that does the hiring. I say, do a FaceTime interview. And they have a series of 25, 30 questions they can ask. During that interview, we know, are they clean? Do they show up, et cetera? First of all, do they show up on time?
Right.
I'd say once we give somebody an interview, 70% don't even show up for the Zoom call.
Really?
And then, yeah, and 30% of them that show up are having technical problems, and then they're talking to their kids and they don't know where we are. So we ask them very simple things like, where's our office? Have you been to our website? What do we do? So you get to see if they're interested. If they pass that, then we have them in for what I call a blink interview. They come in, and then I get to see how they're dressed. Do they stand up and greet me? Do they shake my hand? Do they look me in the eyes? And then I look at 6 things. I look at their hair. I look at their eyes. I look at their teeth. I look at their clothes. I look at their fingernails and their shoes. And you can assess someone's cleanliness very quickly. If they are not showing their best self on the day of an interview, they're not going to come to work on time and neat and clean. So, and then if I like them, then we have them in for a half day, working interview. So, and then my team, at that point, I'm done. My team hires them. If they like them, they hire them. If they don't, and they'll tell me very quickly. So how hard is it to get a job in our office? It's very hard. We are looking for 4 people. We hire about 1 person every 9 to 12 months, and we're always looking for 4 people. And out of everybody who applies, I probably interview 2 out of 100. So by the time they get there, and I tell them that, I go, you've made it here. 98 people didn't make it to this room. And then most of those people don't make it either. So we hire very slow. One of the things we use is called Culture Index. You can Google it if you want. It's the most impactful tool for human behavior that I found, and you use it as well. We all know about the DISC, which is about 40 to 50% accurate. And there are a lot of other things like Strength Finder and Colby Index and his Culture Index. It's a personality assessment, and it looks at 7 different traits. And it takes about 5 minutes to fill out. If any of your viewers want it, just email me. I'll send them one, and I'll tell them what they're like in about 2 seconds. It shows me how autonomous they are. Are they going to tell me what to do, or are they going to take orders? And so I'm not going to want a really bossy dental assistant, but if they're in the front desk working with patients, I'm going to want them to be a little bit more autonomous. Tell me how social they are. Are they going to get to talk all day, or are they going to be quiet? So for a dental assistant, I want them to be somewhat social because they're with the patient. I want to know how detailed they are. For my dental assistant, that's not something that is subject to debate. They have to be detailed. I can't have them handle me a scalpel when I ask for anesthetic.
Right.
They have to remember that. And then it looks at how logical they are. People who are not logical will anger very quickly. I don't want those people in the office. Both of my partners are on the ultimate extreme of logic, as I am. So my partners, I have 2 of them. We never fight. We talk. We could disagree, but we never fight. And it shows me how creative they are, and it shows me how much energy they have. So ideally, I want a Ritz-Carlton concierge for my dental assistant. I want them friendly, efficient, get things done, okay? And then they're going to do what I ask them to do, and they're going to be really pleasant about it. It's almost like they print them. Now, you probably know Salvin Dental, the equipment company.
Yeah.
I always say to Bob Salvin, I go, where do you get these people? Do you have a copier down in North Carolina and you just print these people out? Because they all look like soap opera stars that are really nice, and they're very efficient, and they're great. And he knew how to hire. I don't know if he uses the Culture Index or not, but that is my secret weapon. And, if I get somebody's Culture Index, I know exactly who they are. And my wife and I every family member they wouldn't fill them out, but I made all my family members fill them out. So I know whenever I see the behavior, their Culture Index says that they have a hard time making a decision, so they're having a hard time making a decision. So I don't get upset with people for being who they are. And the Culture Index also shows us not who they are, but who they're being in their job. So what's cool is if someone comes in and they have a great Culture Index, but their job Culture Index shows them not happy, I tell them, I go, oh, you're not happy at your job because you're forced to be, not so social, and you have to be told to do something that you don't really want to do, and you're not very detailed, and you got to make up for the creativity of your bosses because they don't have any. They go, how did you know that? I go, I looked at your 7 dots. And it's pretty cool. So that's something that I love. And again, it's Culture Index with Michael Hall is my teacher. He's part owner of the company. So he's been great. And
he's brilliant. Now go back to this. You said you're always hiring for people. Tell me more about that.
Yeah. Well, I got 22 people. People get sick. There's turnover in a practice. Now, I don't know how, you probably know better than I do. How long does the average employee stay today?
You know, everybody has different statistics on this, but my real thinking is, I think this is where you're going. I believe every company has to have a bench,
Right.
a farm team that you're looking for. You can't just react when you lose somebody. Is that what you're pointing to?
Yeah, that's one of the points, but there is turnover because people
Right.
get married, people have babies, people leave for 9 months, people have carpal tunnel. Things happen. I lost two of the best assistants I've ever had to the military because their husbands were restationed. So so we're always looking. The bench is really important. I always want to be overstaffed, not understaffed. So sometimes I'll see one of my office managers will look and go, they're standing around. I go, I don't care. I don't care if they're standing around. We're getting the job done. We're meeting our production quotas. Everything is organized. If they want to stand around now, that's fine with me because in about 2 hours, they're going to be killing themselves, so they can do that. So I give my staff a tremendous amount of autonomy, but it is important to be overstaffed and to have that bench because you need it, right? Aaron Rodgers, he's no longer the quarterback, right? You
Right.
need the backup. Yeah, so that's my one sports reference.
That's a whole nother podcast in itself. Now, the other thing too, you're a big fan of fee-for-service dentistry. A big challenge in the world right now is how fast PPOs are growing. And I think what you're pointing to in this book, when you start treating people, not patients, you start to move to another place in dentistry where you're actually, you're charging out for your time, your expertise, not for the actual crown or tooth procedure itself, correct?
Yeah, that's spot on. One of the things that I talk about are we procedurists or are we doctors?
Right.
And part of my training, and I could talk to you about this another time because it's sort of a long story, but part of my training was my first day at dental school. Harold Lowe, who's a periodontist that passed away, he's the father of modern periodontology. He says, you are now physicians of the oral cavity, you're doctors. And even though we were freshmen in dental school, they called us doctor. That was very different. 1975, at Georgetown University, they were dumping an alginate on your head if you did a bad impression. And so there was a tremendous amount of respect. He says, but you have to treat the whole body. And so my philosophy from dental school is that we're physicians of the oral cavity and I have to treat people coming out. I had to do what was necessary. We had to treat the infection first. We had to get them periodontally healthy before we do a crown. And that's another whole topic is what's going on with periodontal disease. There's so much undiagnosed periodontal disease. Probably 97% of it's undiagnosed in the United States. And that may be a made-up number, but if you look at the insurance, not much is going to insurance, and half the population has some form of periodontal disease, if not greater, over 60. So I think it's scary not to be a fee-for-service practice. And so when I opened up cold in 1985. I had a white box. I had 800 square feet. It was nothing, no walls. I built the walls. I chalked the floor. I did everything for it. That was my training working for my dad. And my first year in practice in 1985, guess what my production was?
I don't know. Take a guess. I don't know. 300,000, 400,000?
Yeah, 300,000, 1/10 of that, 35,000. So I produced 35,000
in a year.
In a year,
Wow.
first year. My first month, I took in $20. I have my appointment book. It's in pencil.
Right.
I bring it out and I show people when they come, they feel bad. I go, this is my first year in practice. Second year, I did 90,000. Third year, I did 135. My growth was slow. And I never took insurance. So what did I do? I worked in a mall in another state. So Mike Montanero, an orthodontist, says, don't practice in a mall in town because that was a dirty name back then, doing PPOs. So I worked in White Plains, New York, in a Galleria Mall, and I worked in Springfield, Massachusetts, at the Mall of Holy Side, and I lived in Connecticut. So I had my own private practice with no patients, and I supported it by working in two malls. And I went down to NYU and started teaching, and that's where I met Dennis Tarnow and all the other luminaries from NYU. So it was a really good beginning. I had plenty of time to figure it out. And in my seeing my one or two patients a week, I give them great experiences, but it was slow. It is slower growth if you're going to go fee for service. They're not going to say, oh, let me go down there because he doesn't take my insurance. You have to give them something that they're not going to get elsewhere, and that is a great experience. Right. Because people are not coming for great dentistry. They're coming for great experiences. They're coming to be taken care of. And it's slower, but it works. Since then, I have brought in other people in my practice. And not any of my partners or associates have ever taken insurance has always been fee for service. There's nothing wrong with taking it, and I realize that some people think you have to, but you don't. What's sort of cool is that since you're one of the few people not taking it, there's not a lot of competition. And somebody once said to me, maybe I said it, I don't know. No matter what I say, I've stole from somebody else. The feeling. There's no competition in a niche. If you provide super high quality care and give patients a lot of your time and attention and spend an hour with every new patient, they're not going to get that anywhere else. And during that 1 hour, you get to give the patient choices so they can make the best decision. Now, my daughter's a dentist, and she went to school in San Antonio, which is a good dental school. It's a procedure type school. Okay, a lot of procedures. So she came out knowing a lot of procedures. So as she was doing the procedures, and I've given this lecture to the residents at the Periodontal program with Brian Mealy there, and I said to her, you have to give the patient choices and then always let the patient say they can decide. And then the first choice that you give them is to do nothing. All right? What do you mean? You don't have to do anything. And the patient will say, what do you mean not anything? And then the decision gets shifted to the patient. It's amazing how many of my patients say, no one has ever spent this much time. I don't even spend that much time with the patient, but I'm present. And I don't leave the room until they feel comfortable. I remember when I was in my teens, my father had to go see a dermatologist. He had some cancer on his face. Dr. Ostreicher. He's still practicing. He's like 80. He's in my town. And his waiting room, he was by himself. There were like 30 people in his waiting room. So I go into I'm with my dad, and I walk into the room, and Dr. Ostreicher walks in and starts to examine my dad. And I'm thinking like, hurry up, man. You got 30 patients out there. I'm like 16. And he's tending all the time in the world, like there was nobody else. And that's something that I wasn't like that when I first started. I thought I had to be busy all the time. I walk in a room with that new patient or a patient of record or a hygiene room or wherever. That's the only person in front of me. And they feel that human connection. And it doesn't take a lot to connect. Just make some eye contact, talk to them. And it's amazing. It's amazing how patients will respond to that. Yeah. And I still do it today because that's the real fun of going through practice every day.
Yeah.
Walking in there and getting patients to say, thank you. No one's ever treated me this way before. And, most of the patients that come see me are coming from other dental practices, not directly, but they've had bad experiences and they didn't go for a while and then they come back and you get to take care of them. And that's what really turns me on, is to improve the quality of my patients' lives. Yeah. Get them to smile, be happy, feel safe.
Yeah, there's no doubt you're doing it. I want to have you back and, talk about some of the other things that we brought up. I also have a couple other topics I could keep you on for like 2 more hours if you let me. But you are up to a lot of, well, you're a great human being. And Mike, I want you to talk about, you're up to a lot of stuff. You also have, I want people to get your book. Well, first of all, before we talk about it, any last thoughts you have about treating people and not patients?
Yeah, a couple. I do think it's something that if you haven't thought about, it's something to think about. I strongly recommend that people read my book, not because I make a lot of money on a book, because you don't make much money on the books, but I want to change. My goal is to change. I have a moonshot, and I learned this from Peter Diamandis, that we have a different moonshot, for our lives. And if you get up every day and you look at your moonshot, you read it over, it's what you really want to accomplish that's going to impact the lives of 1 billion people. My moonshot is to improve the way doctors and all healthcare providers interact with the people that they serve. And that is by being hospitable and by being present. And almost everybody I talk to does not have a good experience with their dentist, with their doctor, with their healthcare provider, not even if they're seeing a PA or nurse, and I'm a patient. We'll talk about that another time. I've had a lot of dental work done. I have 23 crowns. I've lost 9 teeth. I have 2 bad bike accidents. I've been on the other side, and I've gotten great care as an adult. Not as a kid, but as an adult, I did. And it means a lot. So I can relate to patients. So I think it's important that people read the book, or not. If you don't read, I don't know where else you're going to get this, because not many people who are doctors are talking about this. And, there's a series of videos that you can get online. They're not expensive. They're like $499. And it's 3.5 hours of training for your team. There are 10 modules. And I recommend you watch 1 module a month. And it comes with a workbook. So you get your team to know about this. Because you can't tell your team, like, let's treat patients better. That doesn't mean anything. You have to have some tools for it. I do have some very specific tools. And then I do a lot of programs. I also have programs on surgical things as well. I have a 3-day course in just periodontics. NYU, November 1st through 3rd. I do hands-on programs in my office. I do it through Zimmer. I teach soft tissue, bone grafting, and all that. And that stuff is good. I still like doing that. But my true passion is really the impact. You hear in my voice when I talk about this subject. Yeah, I could teach you how to do surgery. Okay. But, I've done surgery. How many implants and bone grafts and extractions have I done? Thousands. It's no longer that exciting. But every patient, when I get to interact with a patient, that's always different.
Yeah.
It's always a different experience. So take a look at this stuff. Tell me what you think. And then I'm available. You go to my website. You can sign up for our newsletter. You can email me directly, mike@sonicdmd.com. I'm sure you'll provide that stuff for everybody.
Yeah, absolutely. I'm going to highly encourage you guys to check it out. You got to read his book, Treating People, Not Patients. Now, here's how the podcast works. For those of you that are already listening, you know how this works. If you're not taking notes, don't worry. That's what we do. We take notes for you. So I don't care if you're listening on Spotify, Stitcher, iTunes, wherever. You can flip up to the notes, the show notes, and you're going to see links to everything that we have mentioned during this podcast. You can check them out. I also highly encourage you to see Dr. Sonick speak. I think you're a phenomenal speaker. You should check out your programs and make their practices better from top to bottom on all these things. So, Mike, so good to see you, brother.
Thank you, Kirk. You're very hospitable. Great host and a great guy.
Hey, well, we got to have dinner again sometime soon. I don't know when that's going to be. We're going to make that happen, though. So we'll stick around while we say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. If you enjoyed today, which I know you did, just do us a favor, hit the share button, share this with your friends. Keep sending us suggestions for things that you guys want to see. I'll line them up. And until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.